Welcome back. So going back to the growth chart and the importance of the growth chart. Now, if you look carefully inside the growth chart, you would see the weight for age, and that would tell you the weight that child should be for the age. Now, this is why it is very important for that child to go to the childhood clinic or the well baby clinic. If you don't take the child in and you're not monitoring the child's weight, you won't know if that child is thriving. You might see the child looking nice and rosy, but that child hemoglobin could be very low. So you see, no matter how you put it, you should take that child to the child baby clinic. You might just think, oh, the child have a big head, but it could be something's wrong with the child. So you take the child to the childhood clinic, the nurse assesses the child, the GP gets involved, and that child, whatever condition the child is brewing, is prevented. It has saved children's lives. I can give you lots of testimony, and this is why I say it's very important to bring your child to the child health clinic, to the well baby clinic, to be assessed by a health professional. If you don't want to come to the clinic, you can bring the child to the pediatrician, but do not let that child miss out because you don't like the nurse, or because Thanos and them don't know what they're doing. If you don't want the nurse to do it, take your child to a private doctor. Let that child be assessed. Let that child be properly assessed so as to prevent a lot of things the children are enduring now. The child is constipated, and grandma said to give the child prune juice, but it could be that the child has a type of leukemia. You just never know what it could be. Yes, it could be that the child is just constipated. It could be that the child has anemia. It could be that the child has a type of deformity that we don't know about. But unless you take that child in and let that child be assessed properly, and you can't bring the child in and say, you know what, I'm here for well baby clinic, but I do not want my child to be vaccinated. We as healthcare provider, we have the right to honor your wishes. If you do not want the vaccine, we cannot just take it and give the child. No. So you can bring your child to the clinic to be assessed, to be monitored, but you don't have to take the vaccine if you don't want to take the vaccine. It is your choice. All we can do is educate you on the vaccine. We can refer you. We can give you pamphlets so you can read, but it's your choice to let your child. And you must consent for us to give that child a vaccine. If you don't consent, we can't just juke the child just so no. We don't do that. Yeah? So it is important for you to take the child to well baby clinic, not only for the vaccination program, but to see if that child is thriving, to see if that child is reaching its milestone, to see if that child is reaching the developmental stage that it should be at the age that the child is. I think it is important that you bring your child to the clinic as early as possible. Now, the reason I think that is important is if there is a problem with that child, if there is something that needs to be done right away, and you wait till later on in the evening for that child to be seen in the clinic, you delay the process. We know how Grenada is set up. I always say that. We know how Grenada is set up in the sense that we know how not easily accessible things are. The bus situation is a problem. The drugstore, places closed 5 o'clock in the evening, place shut down, especially if you live in Insultes. So you know the situation, you take that child early. If the nurse pinpoints something, you are now able to act accordingly. If the child needs to go to the hospital, if the child needs to go, if you need to go get medication for the child, if the child needs to see a doctor, things are done in a timely manner. But if you wait as a parent to say that, you know what, I'm waiting until I finish, or that time for that today now, I'll bring her next week, you just delay that child, whatever the child is experiencing, you now delayed it by 1 week. You now pushed it back 1 week. We shouldn't think so. If you aren't able to do it as a parent, you ask someone that you trust to take the child to the clinic for you. Now, after age 5, we don't just drop the children, because yes, the child, the well baby clinic runs from age 6 weeks, as I said, to 5 years old, and then the child is seen from time to time after that. If the child has a problem, you take the child to the clinic, let the nurse check the child over. Yeah, if you want to keep checking that child's weight, you bring the child in and the nurse does that for you. You want to check the child hemoglobin, you bring the child in and the nurse checks that for you. We have now started a new initiative in the Caribbean where we are now doing school health clinic. Now the school health clinic runs from ages 5 to 14, and it is done under the primary health care initiative, the primary health care program. So when you get that white slip from the teachers telling you that the nurses are coming to the school to assess the children, you know, do you consent? There's nothing wrong with signing a consent for the nurse to come and assess your child. We ain't coming and peeping your child head to see the child fungus just because. No, we're doing this to continue the child health primary health care initiative, or nurses going to the school. So a team, so we have dentists, we have the doctors, we have the nurses, we have the food and nutrition, and a team of us is goes to the school and assess each and every child from age 5 to 14. If that child needs to be given blood tests to be done, stool samples, urine samples, we do all of that, and you as a parent take the child back to the doctors. We try to keep the children safe and disease free by continually assessing them. It is very important to ensure that your children are being listened to. So you know, checking how many times they go to the toilet, checking if they're having pain, checking if they're squinting by looking at the television, headaches, you know, just assessing, checking their fingers, their toes, checking their skin to make sure that it's nice and clean, checking their head for any funguses. It's important as parents to know what is happening with your children. And if you're not sure and you need advice, this is where the clinic comes in. You take your child to the clinic, the nurse gives you advice. If it's something that she can't deal with, she puts it on to the doctor. If it's something that needs to be dealt with, she takes it on, put it on the dentist. Well, that is why we have a team. In each and every community or every parish in Grenada, there's a team that works together to ensure that children have the best health possible with the best outcome possible. There are well baby clinics set up around the world, in the UK, in the US, Bangladesh, Somalia, wherever you are. The World Health Organization ensures that you have access to a well baby clinic where that child can be checked out for free in what we call the health clinics or in the primary healthcare setting. I can attest that this well baby clinic has saved many of children's life. And it is a joy as a nurse to come or to see a baby come in and that baby is thriving properly. It's also a joy to pick up something that is alarming and have it dealt with, and that child goes home in one perfect piece. It is very satisfying as healthcare professionals to see children being taken care of or being cared for in the proper way, being taken to their appointments, you know, ensuring that the teeth is right. And I know I have seen some hard conditions that our children are growing in, and it is not the fault of the parents, as I said, because some of us just don't have it. But what we have is a free setting that you can bring your child in and get some support, you know. Nothing is wrong with that. And the nurse is there to help you, because if she figures out that you're unable to provide for that child, she can refer you. You know, there are help you can get. So don't be shy or, you know, oh, that nurse and them. No, the nurse and them, yes, we might be firm, but this is just because we are doing it in the best interest of the child and of the family, of yourself as parents. So remember, this is just education and this is general information that I am giving to you so that you can use to better equip yourself, to better go out there, research it. Developmental milestone of every child is important. And yes, some children may meet their milestone at different ages, but this is why we monitor, just to ensure that they're going at the pace, yes, that they should be going at, but that if there is any delay, we are able to pick it up. Healthy development means that children of all abilities, including those with special healthcare needs, are able to grow up where their social, emotional, and educational needs are met. The early years of a child's life is very important for his or her health and development. Remember, the developmental milestones such as saying bye-bye or waving to saying bye-bye is of utmost importance. Even crawling, walking, playing, how they behave, how they interact is of utmost importance in a child's developmental milestone. So, yes, some children have delayed developmental milestone, but some of them are delayed because they don't have the ability, or because there could be problems, whereas some are delayed because that child is just progressing at a slower rate. You as parents, you know your children, and if you think your child is developing very slow and may need support, you speak to the nurse or speak to any healthcare professional to get advice on that. Children are the future of tomorrow, and ensuring that we all have healthy children is very important. Thank you again for joining me. Chats with Desiree. I'll see you in the next one.